This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and I'm joined today by our research fellow.
And I'm Dr. Alara. Today we're looking at a fascinating new study from BMJ Open, published in 2026, titled Current Evidence on Radiofrequency Denervation for Chronic Low Back Pain, a Systematic Review and Meta-Analysis.
This is a topic that is bread and butter for many of us, but also a source of constant debate in the clinic and the OR. Chronic low back pain, or LBP, remains one of the most challenging conditions we manage. Dr. Alara, before we dive into the data, could you set the stage? What exactly was the objective of this meta-analysis?
Absolutely, Dr. Aris. The primary objective of this review was to assess the effects of radiofrequency, or RF, denervation, specifically for chronic low back pain. What makes this study particularly relevant for our audience is that it didn't just look at LBP as a monolith. They looked at the evidence across 4 distinct clinical presentations: facet joint pain, sacroiliac joint pain, discogenic pain, and the ever-elusive nonspecific low back pain.
That's a critical distinction. In neurosurgery, we often see these patients after they failed conservative management. The decision to move toward a procedure like RF denervation depends heavily on the suspected source of the pain. Let's start with the facet joint and the sacroiliac joint. These are the traditional targets for RF, right?
Exactly. The study categorized these as major focus areas. By performing a systematic review and meta-analysis in 2026, the authors were able to aggregate the most recent clinical trials to see if the current evidence actually supports the long-term efficacy we often claim in practice. For the residents listening, remember that RF denervation is essentially using thermal energy to interrupt the nociceptive pathways, the medial branches for the facets and the lateral branches for the SI joint.
And the meta-analysis aspect is key here. It's not just one center's experience, it's a high-level assessment of the effects. Now, what about the other 2 categories? Discogenic and nonspecific pain. Those are often much harder to treat with denervation techniques.
You're right, and the study doesn't shy away from that. They specifically looked at discogenic and nonspecific pain to see if RF denervation offers a statistically significant benefit. As we know, discogenic pain, pain originating from the intervertebral disc itself, and nonspecific LBP often have less clear-cut neuroanatomical targets for denervation compared to a synovial joint like the facet.
Right. If the objective of the study was to assess the effects across these different etiologies, it suggests that the neurosurgical community is still looking for a gold standard. For a junior resident, they might see a facet rhizotomy and think it's a simple off switch for pain. But this paper highlights that the evidence base is something we must constantly reevaluate.
Precisely. The authors focused on current evidence, which is a nod to the fact that older meta-analyses might be outdated due to evolving technology, like cooled RF or pulsed RF, and better patient selection criteria. By 2026, the volume of high-quality randomized controlled trials has grown, allowing for a more nuanced look at how these patients actually fare.
It's interesting that they included nonspecific pain. In a surgical specialty, we try to be as specific as possible with our diagnoses. Nonspecific usually means we haven't found a clear mechanical or structural culprit that matches the symptoms. Alara, based on the study scope, why is it important for us to look at RF denervation for nonspecific pain?
I think the inclusion of nonspecific pain in this systematic review is a reflection of the real-world clinical burden. Many patients present with chronic LBP where the imaging doesn't perfectly correlate with their pain. If the meta-analysis shows a lack of effect in the nonspecific group but a strong effect in the facet joint group, it reinforces the necessity of diagnostic blocks and precise patient selection before we ever bring a patient into the procedure room.
That's a great point. It brings us back to the fundamental goal, assessing the effects. If you're a resident or a student listening to this, the take-home message from the objective of this BMJ Open study is that low back pain is not a single diagnosis, and radiofrequency denervation is not a one-size-fits-all solution.
Well said. This systematic review serves as a 2026 benchmark for the efficacy of these procedures. It forces us to ask, are we providing evidence-based care when we offer denervation for discogenic or nonspecific pain, or should we be reserving these techniques strictly for facet and sacroiliac joint pathologies?
It's all about the evidence. Dr. Alara, thank you for walking us through the scope of this systematic review and meta-analysis. For our listeners, we highly recommend reading the full text in BMJ Open to see the specific forest plots and the strength of the evidence for each of those 4 categories.
Thanks for having me. It's a vital study for anyone treating spinal pathology.
That's all for today's episode of the Neurosurgery Hub podcast. Stay sharp, and we'll see you in the next one.